From Nebraska's medical community.
A recent survey says more than half of Nebraska hospitals are operating in the red, which could lead to fewer services, especially in rural Nebraska.
Brian Master live in the newsroom with a plea for the policymakers.
Nebraska's 108th legislature convenes this Thursday, so they'll have 90 days to figure out a budget, to figure out priorities. Nebraska's hospitals are hoping they get some help in all of this for what they call a financial crisis. Nebraska has 92 hospitals. Nearly 2/3 of them are what's known as critical access. They're rural. They aren't close to other medical facilities, and those operations are struggling.
When I talk to hospital CEOs who have been in the profession for 30, 40 years, they say this is the worst financial situation we've seen.
As state lawmakers prepare to go back to work this week in Lincoln, the Nebraska Hospital Association wants to make sure this crisis is on their radar. While costs for labor, food and drugs skyrocketing, Nebraska's Medicaid provider rates grew by just 2%. Most of Nebraska hospitals' revenue comes from Medicare and Medicaid.
If we don't get rates that keep up with the cost of care, hospitals will have to start looking at services to eliminate. We've started to see that a little bit around the state already. We saw hospitals that own nursing homes in western Nebraska close those nursing homes because the finances couldn't work anymore. We saw a hospital in central Nebraska recently close its inpatient behavioral health unit, something that we need more of in this state, not less.
The call to action is for tens of millions of dollars to keep hospital services intact. With the new governor set to take office on Friday, it's unclear what specifically will come out of the first budget for Jim Pillen. He wants to dramatically change the school aid formula while providing property tax relief. Governor-elect Pillen already negotiated a 22% pay raise for the state patrol. We also know plans are already in motion to build a new prison for $270 million for the nation's most overcrowded prison system. So when the legislative session begins, there will be even more people with big requests during this inflationary period.
We're optimistic. We think Governor-elect Pillen has actually served on hospital boards before in Columbus and at the Med Center. And we have a lot of legislators who care about rural health care.
The legislature convenes on Thursday. On your side in Omaha, Brian Mastry, 6 News.
And we'll start seeing some proposed bills by individual lawmakers on Thursday. The legislative session is expected to go through June.
Tomorrow, the